Do you know why your low back pain isn't just a muscle problem? If you've ever tried stretching your back, foam rolling, strengthening your core, and your pain just keeps coming back over and over again, then this video is for you. Hi, I'm Dr. Norris Golberg from Koru Chiropractic in Louisville, Colorado, and today I want to explain to you why low back pain and sciatica often aren't just muscle problems, because if you treat nerve problems like muscle problems, you'll just keep chasing the symptoms. Most people assume back pain works like this. I've lifted something wrong, my muscles tightened up, it feels really stiff, I just need to stretch it out. And sometimes that's true, and if it works, great. But if it keeps coming back, if the pain is persistent, if the sciatica runs down the leg, or it keeps flaring up every few months, we're usually looking at something deeper than tight muscles. And this is what we see in our office all the time. People who have tried everything right. They've done physical therapy, they've done massage, they've done stretching programs, they've done core strengthening, and yet the pattern keeps returning. They keep getting that pain over and over again, often with increased severity and increased frequency over time. So here's how you need to look at it. Muscles don't create the patterns. Nervous systems control the muscles, right? Muscles tighten for a reason. They tighten because your nervous system is controlling the muscle and is holding a pattern to try to compensate for your body and try to alleviate you from further stress and injury. If the alignment, your posture, or your pelvic balance is off, your nervous system will increase tension to protect you, right? The tension feels like tightness. It feels very muscular, but it's just there protectively. And stretching protective tension without changing the pattern, a lot of times it'll give you temporary relief, but you're just not gonna see long-term change. It's always gonna come back. So let's talk a little bit about sciatica for a moment. Sciatica isn't just back pain, right? It's nerve irritation. And that nerve runs from your lower spine through the pelvis and down the leg. And if the alignment of the lumbar spine or pelvis creates uneven mechanical stress, creates a bulging disc or irritation to that nerve, you're gonna feel it, right? You're gonna get pain, tingling, numbness, burning, and sometimes even weakness. Now, here's what's important. You can stretch the hamstrings all day, you can stretch your piriformis all day, you can massage your glutes, you can strengthen your glutes, but if that nerve is under mechanical stress because of alignment patterns, the symptoms are just gonna keep coming back. And the body isn't confused, it's just responding to the load, it's trying to protect you. And most back pain is treated like an episode, right? It flares up, I pulled something, I overdid it, I put heat on it, I iced it, I took some meds, but usually the pattern just starts coming back over and over again. What we see is your posture starts to adapt more and more over time, your pelvic becomes imbalanced, there's repetitive stress in the wrong areas, and your nervous system continues to compensate to try to protect you. The pattern simply won't resolve until you really get to the root underlying mechanical issue that's going on with your spine and your alignment. At Koru, we look at things not exactly where it hurts. We evaluate your pelvic alignment, your spinal loading, your neurological stress, your postural adaptation. We measure all of that first, and then we make gentle and specific corrections designed to change those patterns and not just calm down the symptoms. A lot of times we find the problem, the underlying issue, is not always exactly where you feel it. For example, we've got this 10 to 12 pound bowling ball up here, and if that is not sitting quite right, if it's off to the side, or if it's forward, the rest of our body is gonna have to adapt. Otherwise, you're gonna have a lot more compensation and pain up here. But typically what we do is we balance our pelvis and our hips with our head, right? And so what happens is you start putting little shifts and twists into the pelvis. Sometimes the adjustments don't even need to be done there, they need to be done up here in your upper cervical spine. The fortunate thing is, as a corrective care chiropractor, I'm not just a specialist in NUCA, which is a advanced upper cervical technique, I also take care of the rest of the spine. So if I see a misalignment in your pelvis and your upper neck, I take care of both of them. But like I said, a lot of people have just been chasing the symptoms and they've treated their low back and they haven't gotten the results they want. And we make these really gentle and specific corrections designed to change these patterns and calm down the nervous system, get it functioning better, And we do this with no aggressive twisting, cracking, or popping. We don't have to chase the flare-ups. We just use precision to get a better long-term outcome and solutions. This is when the cycles stop just coming back over and over again. We're able to break those patterns, we're able to break those cycles and get you a better long-term solution. So if you've had low back pain or sciatica and it keeps coming back, and you've treated the muscles and it keeps coming back, it may be a neurological pattern. And that's exactly what we evaluate in our office. So if this sounds like your story, we're here to get clarity, we're here to help you find a solution and guide you to better alignment and better overall health. So thanks for watching. I'll see you in the next video.